Thank you.
Good evening, everyone. I thank you for waiting in the waiting room while we were getting the presentation up and running. I'll give it one more minute just to let everyone join. So I am Kim Klein. I'm the Assistant Superintendent for Support Services and School Safety in District 21. I have the pleasure of working with Olivia Aguado, who is our district contact tracer and community health liaison. So due to her efforts, we have been able to partner this evening with Dr. Galeano. Healthcare includes education and being informed. So this evening, I would like to thank Dr. Galeano for providing information on the COVID vaccinations as it relates to our students 12 and up. Dr. Galeano is an assistant professor of pediatrics at Rush Medical Center. She currently works as a general pediatrician at North Riverside Rush Pediatric Clinic. Dr. Galeano completed her bachelor's degree in microbiology at the University of Florida with medical education and pediatric training at the University of Illinois School of Medicine. She will present the information in English for the first 30 minutes this evening, and then we will also provide a Spanish session. So thank you for attending this evening's event, and for those who submitted questions ahead of time, I thank you. So welcome, Dr. Galeano.
Thank you. Thank you, everybody. I see that the numbers of our participants are increasing, and that's always a good sign, and a sign that we're gonna have a lovely conversation. And thank you for your questions ahead of time as well. So yeah, let's just let's start. So again, thank you for attending, and I know that a lot of you are parents who have a lot of questions and a lot of concerns. So today's goal is basically, to talk about obviously the COVID-19 vaccine and why get vaccinated, why vaccinate our kids who are now 12 and up. The science behind the COVID-19 vaccine. We're going to talk a little about, the safety and what so far, what we know so far. And then we're going to address some of the questions. And I think a lot of the questions overlap. So we're definitely going to hit some main points and hopefully answers everybody's questions. Thank you, Kim. So of course, right, everybody knows that we have a pandemic, but today I think it's more important to think about our teenagers, especially now 12 and up. There's a couple of good things about this population, majority of them are healthy, which is, it's a good thing. We have seen throughout the pandemic that even though kids and teenagers can get COVID-19, the majority of them basically, are okay, meaning they have a minor disease and then they're able to go back and, just feel better overall in a couple of days and not necessarily be vaccinated. Also, I want to talk about why, basically we should get them vaccinated. I already said, right, that the majority of them are healthy and the majority of them basically do not get really sick. But the truth is that even though the number is very, very small, we have had kids and teenagers, young adults who can actually get very sick. And what I consider as a doctor, sick, a lot of them have to be admitted to the hospital. They had to be intubated. They had many other complications. So that's one key reason why, we should at least consider vaccinating them. The other one would be, because this is a virus that can transmit from person to person. So if they get vaccinated, we can protect maybe other kids who are unable to get the vaccine for some other reasons, and in general protect the families and any other person who might be unable to get the vaccine. And more importantly, if they don't get COVID-19, we don't give a chance of virus to actually mutate, because that's what the virus does. Once you get infected, it can mutate in your body. And the final reason, right, and the reason that we all are waiting for is to go back to some sense of normalcy, right? To go back to our lives before, to the lives of the teenagers that used to go to school, be with friends, go out to the theater, just have a normal life. Just hopefully go back to a life where their physical health and their mental health is, good, that we don't have any more reasons to believe that they're going to get sick, if they go out and go to theater, just hang out with their friends. So I think that, basically one of the three main reasons why we should consider at least, vaccinating them. Thank you. I think this is just a slide, to provide all the parents who are joining us, just to show you something very graphic and see that how a little bit of the statistics about COVID-19. You can see on the slides that the daily cases are actually decreasing. And you also see how the number of vaccinations have increased as well. And you see how the daily new deaths are decreasing as well. And this can be for a lot of reasons, remember, right? Like the daily new death. Many people who, the elders, right? Adults who may have a lot of medical conditions, they're already being vaccinated. So they're at more risk, obviously, right, of getting sick and having to go to the hospital, be intubated, and ultimately dying. But also it's because we have been vaccinated, and also because we're still taking precautions. Thank you. So I think I wanted to talk about, right, the main reasons why we should vaccinate. And like I already said before, most of the kids, they do really well. And when I say that, I mean that from experience, right? We see a lot of things in our clinic, a lot of babies in our clinic and children and adolescents that when they had COVID-19, they had kind of what seemed like a minor cold. Some of them may have some diarrhea, but they were able to go back home and they were able to sort of rested and have fluids and, the usual things that a pediatrician always tells you. Make sure your child is like well hydrated, that you're able to manage this fever, that they do not seem lethargic, that they just close to their baseline, how they usually are. But the truth is that there have been some cases, even though they're very minimal, that kids are very, very sick. And I am pretty sure you heard this in the news many, many, many times. And it was really scary. First, they were calling something like Kawasaki. Kawasaki is a different syndrome, but the multisystem inflammatory syndrome in children that it's caused by COVID-19 can make them very sick. So this is, again, not trying to, I don't want to sound like we're trying to scare anybody, but this is something that you also need to take into consideration when you're making that decision, or at least entertaining that decision. Because even though most of our kids do have mild symptoms, unfortunately, up to these dates, you can see the number of cases of the multi-inflammatory syndrome and the numbers that resulted in death. The problem is that those that did not, this ended up in death, unfortunately, they did have a lot of medical complications. And, we can talk about some specific complications. Some of them, unfortunately, even had to have a limb removed. There were many complications, but really the point is that even though more of them are okay and they have mild symptoms, there is a minority that can still get very sick. And I know this is something as a parent, it's always on the back of your mind. So you should have this in the back of your mind as well when you're making that decision. Thank you. Just a little recap, and I know you guys have heard this many, many times in the news as well, about the vaccines that are available for COVID-19 in the United States, right? Because we know that there's some other places where they do have other vaccines that have not been approved. But the specific one that now we know it's approved for kids who are 12 and up is the Pfizer vaccine. Pfizer started their trials a while ago, meaning like since last year, probably by the end of the year, with teenagers and kids who are 12 and up. So this is the one that we're going to, talk about the most, and the trials that they were done, the data that was obtained from it. And then I think in the process, we're going to be able to answer a lot of the questions that some of our parents sent. Thank you. So I think I've seen this question before as well for the booster shot. Yes, they are ongoing studies suggesting that we might need a booster. The final thing has not been said about this. About the infections. There have been cases where people did get the vaccine and they can still have COVID-19 as well. And so you might say, well, so what's the point of us getting it, right? But the thing is that even though you might get actually COVID-19, it's going to be a lot mild than it should have been, it would have been if you did not get the vaccine. The rates of death, the rates of hospitalizations, and the rates of disease in general have decreased. And that's a good thing. And that's why we are advocating, or at least providing the information so people can contemplate this idea. And I like that, we are reminding people to keep your vaccination card as well. Thank you. This is another thing I think that, it's going to answer a lot of the questions too. How does it work? One thing that I want to say, the mRNA technology, it's not new. It has been studied for many, many years, actually. There are actually people now who have PhD, doctorates in this technology. They have dissertations when they have to, gain their PhD based on the knowledge of this technology. So this is nothing new. The reason that maybe you haven't heard of it, it's because some of the efforts that have been done to produce other vaccines for other medical conditions, for other viruses and bacteria, have not been successful, because that might be for many other reasons, and it has to do mainly with the vaccine, with the disease that they're trying to prevent. But the truth is that this is nothing new. You also have to think about that vaccines, even though when you go to the doctor and you take your child to the pediatrician, you get all of those vaccines. And I know you ask the questions, and I know you ask them what's the name and what is it for, and what could be the actual complication. But one of the things that necessarily you don't ask is what's the technology behind it. And a lot of the vaccines that our kids get at 2 months, 4 months, 6 months, 11 years old, all of them actually have different technologies. So they're not all the same. So it's nothing new to have a different technology for vaccine. Measles, MMR, is a live vaccine. Polio, it's not a live vaccine. There's many other different types. So you have to think about that all of this research has been done for years and years. So the fear that this is a new technology, it's really been a little unfounded, it's not really founded in actual facts and science, because it has been studied for many, many years. Obviously, what is new, it's COVID-19. And the reason that they were able to do it, what it seems to the public so fast, it's because number one, well, the technology was there, right? And number two, it just so happened that COVID-19, it's kind of like the new kid on the block, if you want to think about it that way. It's like the cousin that you didn't know before. because there is a family of viruses, and coronavirus belongs to that family. So we already know that. But common cold that you actually get every year, actually, it's kind of in the same family of the coronavirus. So maybe you're taking your kid to the hospital and someone swabbed their nose, and then you got a sample and like results, and it says a number of different viruses. You may have seen the name coronavirus before. It just wasn't COVID-19. So those are the reasons, why they were able to develop that vaccine, what it seems to the public, very fast, but it wasn't. And the technology is not new at all. This kind of goes back to, our basic biology classes. But it's basic science. So it's absolutely nothing new. I want to make that 100% clear. Yeah, this is, a little bit more what I was talking about, right? How there are many different technologies, how the vaccines work. Let's talk about this one, the Johnson Johnson vaccine. This is a little bit different. This is not an mRNA vaccine. The way that it works is that they use a common virus, and adenovirus is one of those common viruses that we get every single year when we get a cold. So they use this particular virus, not the full-on live version of it, but they use it as a vehicle essentially to deliver a way that the immune system is going to wake up and recognize COVID-19 once you encounter it. So this is another example of like how there are many different technologies to do vaccines. And you see how like we have an example here as well, that how they have used this technology as well in the past for other vaccines like the Ebola vaccine, which is something very complicated, and they still have to keep working on it. But the point here is that they work in a different way, but it doesn't necessarily mean that they are new. And also you have to keep in mind that they have studied the safety of it. So it's not like, I don't want you to be scared and think, oh my God, now we're injecting one virus and then another one. It doesn't mean you're going to get sick from it. That's not the way, it works. Our immune system does not work that way. And scientists are basically they study the immune system first, and then they develop this way, this technology to create the vaccines. Thank you. I think this is the $1 million question, right? Like, why is everybody's asking the same question? How did this happen? Well, number one, right, we had the technology already. It wasn't anything new. And I'm talking specifically about the mRNA technology. Second, think about it. The whole world was essentially trying to find a vaccine. And it's not the same as trying to find a vaccine for malaria, for example, which, true to be told, right, it doesn't affect all the countries. Not everybody has an interest on it. So in this case, it was different because there was a lot of investment from many governments, specifically from the government of the United States. And also the trials that were being done and the way that it was being done, many of those things that are usually done one step after the other, not necessarily because of safety, but mainly because they have to be approved by the government, because of funding. A lot of these steps were doing in a parallel way. So there wasn't like a long way to get this approved and to get the next step approved. That does not mean that safety was not taken into consideration. So that's what you need to think about. And obviously because we had a pandemic, right? And that's why the government of the United States decided to give these companies the emergency use authorization. And things don't stop here. Once they produce the vaccine, there is many steps in place that help us to keep records of what happens after vaccines are given. Vaccines are nothing new. Fun fact, the first vaccine actually was for smallpox. it was actually tried to create it back in the 1796, and finally we were able to eradicate smallpox. So this is nothing new. The steps that are in place for us to monitor the safety of vaccines have been here for a very, very long time. So we just, make sure that you guys are aware of this, think about this, and get the right information. It's no new technology, no steps were skipped, and safety was not ignored. Because otherwise, the independent panel that, ultimately approves the use of vaccines in the general population would not have approved it. Also, think about this. The trials that were done in people who, I'm talking about the adults first, and then I'm going to talk about the ones done for children. The adults, we're talking about at least 40, 50,000 for the Pfizer vaccine. The trials for kids, although I do not have the actual demographics, we have an estimate of the number of, kids who were in the trial, and we're talking at least in the thousands. So it was tested in these people, these patients who were monitored closely. So the safety of the vaccine was never compromised because of how quickly seemed to the public, how quickly it was produced. And the FDA, is the main agency that's basically overseeing the clinical trials and all the research that was done before. And they continue to do that by, having steps in place in ways that hospitals and clinic can let them know, if there are any side effects, if there's anything that happens after the vaccines are given. Thank you. So this, by the way, I got my first COVID vaccine back in December when it was the only one that was available was the Pfizer vaccine. Not because of what I thought it was the best one, just because it's the one that it was available. And because we as medical professionals, we work with so many people. For me, when it came to think about the side effects, and then it came to what could happen if I get sick. So I decided to get the vaccine, knowing really well that there's always side effects for vaccines. Most of the side effects are short-term. And you can see the list in here. And I think somebody already, or you yourself already experienced some of these things. Most of the side effects that are experienced are mild. Now, we do not consider an anaphylactic reaction necessarily a side effect. That's an allergic reaction. And for those parents who do have kids who have allergies, they know this really well. They know that they have kids who have a peanut allergy, and they might have gone into an anaphylactic reaction where they cannot breathe. They have problems breathing, their face is swollen, their lips are swollen. That's a whole different thing. And the possibility of somebody having an allergic reaction to the vaccine is always there. It happens very, very rarely. I actually myself only so far met one person, was an adult, who did have an anaphylactic reaction secondary to the vaccine. And this person, it's not going to get this vaccine again because now we know what happened. But most people get minor side effects. And this is one important thing you have to think about. So when you guys go get the vaccine, and after you hearing all the evidence and thinking about it, talking it out as a family with your partner, and you decide to take your child, make sure that you guys stay there for the amount of time that it is recommended. And the reason being, because like I said, even though it's very unlikely like this will happen, you want to be there if it happens, right? And I'm talking about the anaphylactic reaction, the allergic reaction. So if they instruct you to stay there for 15, 30 minutes, make sure you do that, because there will be health professionals who can help you at the moment. I know there's many sites where you can get them, but you will see that especially in the hospital, you will go and you see there's a nurse, there is a doctor, there's a lot of people around it who have the medications, that they will need in case they need to treat you. But again, it's very unlikely. Allergic reactions were seen in the trials that were done for adults, but in the trials that were done by Pfizer in 12 and up, actually, there were no kids who had an allergic reaction. No anaphylactic reactions are in the data, actually. That did not happen. That might have been for different reasons. Think about it, though, because the number of patients who were in the trial, it's a lot less compared to the ones in adults. So there's still the possibility, but actually in this age, 12 and up, allergic anaphylactic reactions did not happen. I know that this is going to bring up a lot of questions about, there you go. It's going to bring a lot of questions about allergies, medications, and other things. So let's talk about, kids who have allergies, right? I already mentioned those who have food allergies, like peanut allergies, or they have an allergy to amoxicillin or penicillin. So food allergies are one thing. Allergies to medications like amoxicillin are in a different category. So if you have a child and your family has asthma, eczema, and food allergies, that's genetics. That means that your child has higher chances of having food allergies. If they have food allergies, this has nothing to do with them, having a COVID-19 allergy. Because first off, obviously, COVID-19, doesn't have any ingredients that the foods have, doesn't have any eggs on it, doesn't have any latex on it. So if your child has an allergy to foods, to medications like amoxicillin, they should get the vaccine as well. There is no reason for them not to get it, because I know this brings fears to the parents who have experienced an anaphylactic reaction with their child. Now, if you take your child and he or she gets the first COVID-19 vaccine and they have an allergic reaction and they have an anaphylactic reaction, they will not get that vaccine again. That is a totally different scenario. So I just want to make sure that's clear. Also, medical conditions. Like I said, most of our kids at this age, right, most of them are healthy. And the truth of the matter about the patients or our adolescents who were recruited for the trials, most of them were healthy. So I cannot tell you that trials were done in kids who have, for example, medical conditions with their, that it's affecting their immune system. That wasn't done. And then we'll talk about that, I think, because there were some questions as far as genetic conditions and immune system. So we'll talk about that again, but I want to make it clear, having a food allergy, medications allergy is no reason for you not to consider giving them the COVID-19 vaccine. Thank you. So as you can see here, so I am not an obstetrician or gynecologist, I'm a pediatrician. I do obviously talk to a lot of parents who recently gave birth, to a lot of parents who are breastfeeding, to a lot of physicians that are breastfeeding as well. And they all got the vaccine. They all received the vaccine. The association, for obstetrics and gynecologists, they do recommend every pregnant woman to have, I think, a talk with their doctor. And this has to do with whatever medical conditions they may have. If that person didn't know that they were pregnant, and if they already had the COVID-19 vaccine, they should continue to get the vaccine. They should finish the course, meaning the two vaccines. There's really no known contraindications for somebody who's pregnant or contemplating to be pregnant not to get vaccinated. I think we're going to touch on this a little bit because I think there were some parents who were asking about the fertility of the kids, for in the future. So we'll talk a little bit about it as well. So this slide, it's about who participated in the trials, but this is who participated in the trials that were done for adults, meaning for patients who were 17, 16 and up, not for the ones who are 12 years old and up. We do not have the data that breaks it down by ethnicity, as you can see in this slide, for our 12 and up patients, only for the adults. Even though the representation is not as equal as we would like it to be, you see that there is still a good representation of, Asian, Latinx, African Americans, and white. So this is a good thing because we want to make sure, right, that that everybody is represented, and then everybody participated in the trial, because that's how our population looks like. But this is not the information about the trial done in 12 and up. I just want to make that clear. Thank you. This is, again, a little bit about the adults who participated in the trial, because like I said before, right, adults have a lot more chronic conditions than kids. So this is just the data. And I'm pretty sure you might have seen, you may have seen this before about the data, the conditions that some of the participants in the trials had. Let's see. So no, it's not mandatory, right? Taking the COVID-19 vaccine. I think some institutions in the future might move towards that. And remember that the authorizations of this vaccine was an emergency authorization. So for schools or for other places to make COVID-19 vaccine mandatory, these vaccines have to go through the whole process of full approval through the FDA, because the initial approval was that emergency one that was granted by the FDA and the government. I think, again, touching a little bit about what we talked before, how come it was developed so fast? To the eyes of the public, it seems that it was developed too fast, but that doesn't mean, again, that safety was put aside or that the technology is new, because it is not. Is the vaccine effective and safe? Well, effective, I'm pretty sure you heard this in the news as well, right? They were talking about the 95 and 96% and all of this. No vaccine is 100% effective. Let's start there. But these numbers and the data that was obtained from the studies was really, really good and really encouraging. Safety of vaccine, we will talk about that a little bit as well, I think, to address some of the questions you guys had. And will the vaccine change my DNA? No. And the reason that will not happen, it's because, so let's go back to biology 101. You have the cell, and in the nucleus of the cell, that's where your DNA is. And the mRNA is actually in the outside part, not where your DNA is. So scientifically, it's not possible for this vaccine to change your DNA. It cannot alter your genes. mRNA, it's in the outside part of the nucleus, and it works in different ways, and it has a different purposes. Has nothing to do with your DNA or the characteristics that you would have as a person when you grow up, or the color of your eyes, your fertility. That is not the purpose of mRNA. So I just want to make it, really clear that scientifically that is not possible. So we are going to, well, by the way, anybody who actually wants to, ask us a question right now, they can definitely do so. But we're going to try to address some of the questions that were sent previously to us. One of the things that I saw that there was a concern from a lot of our parents was that, is this going to change anything regarding their menstrual cycle over like 12-year-old females and up? Again, I'm not an obstetrician, but the American College of Obstetrics and Gynecologists has already said that reviewing the data, all the data that was in the studies for the people who participated in the trial, there was no reason to believe that anybody is going to have any side effects related to their fertility. There is anecdotal things, meaning that we're hearing some people say, my period might have changed. I had some spotting after it. If this happens 1 or 2 times, that doesn't mean that your child cycle is going to change. And another thing you have to think about is that usually 11 and 12-year-olds and 13-year-olds, that's when they're having their first period for the first time in their life. So in the first year and a half or first 2 years of their life, their period can actually be very spotty to begin with. And that's because the whole process that dictates how often and how many days your period is going to last, it's actually a very complicated process that comes down, that it starts in your brain. It has many steps and it's controlled by hormones. So the first year and a half, 2 years of you having your period, this is not working quite well. So COVID-19 vaccine or not, you will probably see this in your teenager who's going to have their first period. So I don't want our parents to automatically think that this is because they have the COVID-19 vaccine. When the studies were done in animals, there were no concerns about fertility issues. Now, I saw some of the questions that said, what about long-term data? Well, think about it. What do we call long-term data? The vaccine has been available only since December, and the trials obviously ended before that. But so far, up to this point, there hasn't been any concerns about fertility. There's no studies or publications. And when I say publications, I mean scientific studies published in scientific journals that are talking about having any, side effects when it comes to fertility for women. I'm pretty sure that if you have had, unfortunately, the problem of having, infertility and having to go to a doctor and go through a long process, the word infertility is not mentioned until there's many other studies done and you have been trying to get pregnant for a long period of time. So there are no studies, there's no scientific data that says that your child, your 12-year-old, is going to have infertility issues because of it. So, and if they ended up getting the vaccine and they start having, let's say that they have their first period today, and then it doesn't come back next month, and it doesn't come back in the other month, and then it comes back in 3 months, that is most likely because the reasons that I talked about before, right? Because the whole system that controls this hormonal process, it's just starting. So we already know that at this age, you might have your period for the first time and it might not come back in a year. It might not come back in 3 months. It might not come back in 6 months. And I know that because we know the human body and because we see this in clinic all the time. So I want to make it clear that's not a concern. We always talk about long-term data, and I think I saw a question from one of our parents again asking, should I wait until they get their first period for them to get the COVID-19 vaccine? Again, there is no scientific data to back up that. You should not wait. If you think that you want them to get the COVID-19 vaccine, please don't wait until they get your first period. You don't know exactly when they're going to get it. And then you might wait, they get the first dose, and then their period might not come back in 3 months. And then you're going to start thinking, oh, it was because of the COVID-19. Well, most likely it isn't, because we know how, our 11-year-olds and our 12-year-olds we know the process that they go through. We know the time it takes. We know how long it takes from the moment they start having breastfeeding to the moment they're going to have their period. That usually takes about a year and a half. So I don't want you to be concerned about that. Kim, was there any other questions that you can think of related specifically to the
so Dr.
menstrual
Galeano,
cycle?
Yeah, Dr. Galeano, no, not related to that, but let's answer one more question and then let's end the English portion and move to Spanish. So the other question would be thinking about developmental disabilities, right? Students who might have an autism spectrum disorder. Does the vaccine have any adverse effects on sensory processing?
I remember that question. So first off, there is no vaccine so far that we are concerned that causes autism. Now, and there's no concerns currently that this vaccine is going to create problems with kids who have sensory problems. But also remember that I think this is a very specific question, as well as like, what are the reasons why your kid has a sensory problem and what is the specific diagnosis? So you might want to talk specifically to your pediatrician about it. But there is no scientific data to say that there are concerns about this. Kim, I think I saw one more question that I really wanted to answer in English from one of our parents who said, I believe that they have a scleroderma, which is, there's some component of genetics and their specific questions their question was very specific, but I just want to answer to that. Number one, if your child doesn't have any medical conditions at the moment, that doesn't necessarily mean that they will have it. Also, when you said that there's a genetic condition, I don't know if you have had already genetic studies done, and if we know that what is the possibility that your child will have that genetic condition. So that's one part of the question. And the other one was that they were talking about Bell's palsy. I don't know if you guys know, but some of the side effects reported for some adults who had the COVID-19 vaccine was something called Bell's palsy. That was not seen in the trial that was done for 12 and up. No child in that trial had Bell's palsy after the vaccine. So that was a very specific question, and I wanted to make sure to answer that and just let them know that there was no Bell's palsy as a side effect in the trial done for the 12 and up.
Okay, thank you. Again, we want to be able to provide this presentation in Spanish, and so at this time, we are going to flip to that presentation. So thank you all for attending. Again, this was to hear information from a pediatrician, and we know that every single parent needs to have these conversations within their family and make the best choice for their child. So have a great evening. And then Dr. Galeano, I will flip back to the beginning.
Thank you.
And then I'll go ahead and start, Kim.
Okay.
Thank you.
Buenas noches. Queremos agradecer a la doctora Xochil Galeano por acompañarnos hoy. Ella nos va a dar una corta presentación sobre la vacuna de COVID. Esperemos que hoy reciban información que les ayude a hacer la mejor decisión para su familia. La doctora Xochil es profesora asistente del Departamento de Pediatra en el Centro Médico de Rush. Ella sirve como pediatra en la clínica North Riverside Rush. Después de emigrar de Nicaragua, ella completó sus estudios de microbiología en la Universidad de Florida. Ella asistió a la Escuela de Medicina y completó su residencia en la Facultad de Medicina de Universidad de Illinois. Bienvenido, doctora Galeano.
Gracias. Buenas noches a todos. Vamos a básicamente hablar vamos a hacer la presentación en español. Vamos a tratar de hacerla un poco más rápida, pero sin dejar ninguna cosa que sea importante. ¿Está bien? Okay. Bueno, rápidamente, ¿cuál es la razón por la que estamos aquí? Para hablar de por qué, las razones por qué deberían de vacunar a sus niños, especialmente ahora los que tienen 12 y más. La ciencia, o sea, todos los estudios que se han hecho antes y por cómo esta vacuna llegó a hacerse. Obviamente si es segura. Y vamos a hablar de las preguntas más comunes que se hacen sobre la vacuna. Gracias. Como les estaba diciendo, ¿no? ¿Por qué deberíamos vacunar a nuestros niños? Primero quiero ser muy, muy clara de que los niños sí les da esta enfermedad, pero la mayoría de ellos no se enferman tanto. La mayoría de ellos que hemos visto en la clínica o en el hospital siempre básicamente tienen como un catarro. Pueden tener algún problema, tal vez no quieren comer, tienen unos días de fiebre, pero generalmente se van a la casa. No necesitan necesariamente estar hospitalizados, no necesitan tener tanto cuidado como una persona mayor o alguien que tenga, por ejemplo, diabetes. Es muy diferente. Pero a pesar de que es bajo el número de los niños que se enferman, siempre hay unos que se enferman bastantes. Entonces es una de las razones por las que hay que contemplar la idea de vacunarlos. La otra es para proteger a toda la familia, porque entre más personas nos vaccinemos, entonces vamos a evitar que el virus se vaya de una persona a la otra y le damos menos chances de mutar básicamente, porque si te infecta te puede mutar en tu cuerpo, o sea, puede cambiar. Esas son las razones más importantes y obviamente porque pues queremos que regresen a la escuela, queremos que puedan rejugar con sus amigos, queremos volver a la vida normal de antes. Rápidamente solo quiero enseñarles esto y básicamente lo que está mostrando aquí es que el número de nuevos casos de COVID está bajando, el número de vacunaciones está subiendo, ahí lo pueden ver en la parte del medio que está en azul y el número de personas que están muriendo está bajando también. Siempre las hay, no nos equivoquemos, siempre hay personas que siguen infectándose, pero está bajando, al igual que el número de personas que han muerto. ¿Se acuerdan que estábamos hablando de las razones por qué los deberíamos de vacunar, no? Y que ya sabemos que muchos de esos niños no se enferman, pero la realidad es que algunos sí se ponen muy enfermos. El número que ustedes ven ahí que dice 3,742 es el número nacional reportado hasta ahora que a los niños que les dio el síndrome inflamatorio. No sé si lo escucharon en la noticia, este síndrome donde los niños se ponen muy enfermos. El síndrome inflamatorio multisistémico les causa muchos problemas y tienen que estar en el hospital, muchas complicaciones y desafortunadamente 35 de estos 3,742 niños murieron. Estos niños les dio la enfermedad del COVID y después semanas se pusieron enfermos y presentaron todos estos síntomas y eso fue lo que los hizo terminar en la sala de emergencia o estar hospitalizados. Yo quiero que también tengamos en cuenta esto cuando contemplen la idea de darles la vacuna. Sí la podemos cambiar, gracias. Esto simplemente estamos hablando de las vacunas, ¿verdad? Que están ahorita en los Estados Unidos, pero realmente la única que está disponible para los niños de 12 y más es Pfizer. Está la otra vacuna que es Moderna y la de Johnson Johnso, pero estas todavía no están aprobadas para los niños de 12 y más. Um, y ya sabemos, ¿no? Ahora de 12 y más. Esto es solamente para recordarnos eso. Muchas de las personas preguntan, ¿no? ¿Cuándo vamos a tener nos van a dar otra vacuna de estas? ¿El otro año también? Sí, hay muchos estudios que se están haciendo. La respuesta final a eso no se ha dado todavía. Entonces, no sabemos si vamos a tener que ir otra vez al mismo lugar a que nos den la misma vacuna el año que viene. Es simplemente importante que ustedes tengan prueba de que se vacunaron o que llevaron a sus niños a vacunarse en caso de que esto se tenga que hacer. También quiero hacer claro que ninguna vacuna es 100% segura. Ninguna vacuna es 100% eficaz. Entonces sí, ya se han reportado casos en personas que tienen la vacuna y les ha dado la enfermedad. Entonces, no quiero que tengamos la idea equivocada de que la vacuna es 100% segura. Lo que sí se sabe es que puede evitar complicaciones, o sea, que te puedes enfermar, pero que no va a estar tan serio, que no van a terminar en el hospital y el número de muertes sí es bajando por la vacuna. Eso sí creo que lo tengamos bien claro. Y otra cosa es que en los Estados Unidos hay una manera de seguir y siempre estar viendo todas las personas que fueron vacunadas y observarlos y mirar cuáles son los efectos que se ven después de la vacuna. Acuérdense que no ha sido mucho tiempo. Entonces no podemos hablar tampoco de efectos a largo plazo. Que la realidad de las cosas no hay. Las vacunas las hemos estado dando por mucho, mucho tiempo y muy pocas vacunas, por decir casi ninguna, tienen efectos a largo plazo. Hay unas que tienen efectos grandes, o sea, reacciones alérgicas y eso es diferente. Entonces quiero que tengamos esto en cuenta cuando contemplemos la idea de llevarlos a vacunar. Gracias. Esto es simplemente para recordarnos, ¿no? Primero que hay muchas maneras de cómo hacer una vacuna y también depende, ¿no? Del virus o de la bacteria. ¿Cómo funciona esta vacuna de Pfizer? Básicamente, los científicos estudian cómo funciona el cuerpo, cómo estudia la célula humana y se aprovechan de eso básicamente y hacen que parte de tu cuerpo empiece a producir esa parte que está en el virus para que, digamos que es como ir a la guerra, ¿no? Yo siempre le digo a mis pacientes, ¿no? Si usted va a ir a la guerra, usted quiere saber cómo su enemigo se viste o cómo se ve. Entonces, más o menos es así. La vacuna lo que hace es que le enseña al cuerpo mucho más antes de que usted esté infectado, cómo se ve, para que ya el cuerpo esté preparado. Muchas de las cosas que están diciéndose sobre la vacuna, especialmente en la comunidad hispana, es me va a causar problemas de infertilidad, me va a cambiar mi código genético. Eso no es posible, científicamente eso no es posible. Y quiero hacer también muy claro eso, porque hay miedo de que esta tecnología es nueva, pero esta tecnología no es nueva. Tiene 10 años y más de haber sido estudiada. Y la razón que la han estudiado por 10 años y más es porque han tratado de hacer vacunas para otras enfermedades. Entonces no es nueva, la tecnología no es nueva. Lo que es nuevo es el virus, que lo conocimos hace más de un año, para hacerlo muy, muy claro. Bueno, esta es otra, que solo queríamos hablar de cómo funcionan las otras vacunas. Por ejemplo, la de Johnson Johnson se usa otro virus. Uno de esos virus que te dan un catarro todos los años, utiliza ese virus, se aprovecha de ese virus y de ese virus entra a tu cuerpo y lleva algo que pueda ayudar al cuerpo a empezar a producir anticuerpos para poder pelear cuando te dé la infección de verdad. No te va a dar COVID, o sea, la enfermedad de COVID no te la va a dar la vacuna. Tampoco te va a dar la enfermedad por el otro virus, porque ese otro virus no es tan fuerte, no te lo inyectan así de fuerte. Entonces, simplemente lo que hay que aprender de aquí es que hay muchas maneras de hacer vacunas. Tal vez esto no se habla todo el tiempo cuando ustedes van al doctor, pero todas las vacunas que sus niños reciben son hechas de una manera un poco diferente dependiendo de la vacuna que sea. Entonces hay que tener esto en cuenta. Estamos hablando de otra vez que quiero básicamente llevar el punto, ¿no? De que la vacuna no fue creada realmente tan rápido como toda la población piensa. Primero porque la tecnología no era nueva. La tecnología no es nueva, la han estudiado ya por 10 años. Las compañías que lo estaban preparando o haciendo la vacuna tenían mucho apoyo. Y en este caso, eso no ha pasado con otras vacunas porque el mundo entero no estaba tratando de producir esta vacuna. El gobierno les ayudó bastante a producirla, pero eso no quiere decir que las etapas que se tenían que hacer no se hicieron. Eso no quiere decir que no se hizo los estudios para ver si no iba a producir otros problemas en el cuerpo humano. Eso no quiere decir. Y aparte, después de que la vacuna es producida y se le da a las personas que decidieron ser voluntarias para que les dieran la vacuna por primera vez, siempre se sigue un proceso y siempre lo siguen observando. Entonces, no quiero que piensen que porque el tiempo de que se tomó hacer la vacuna fue casi como récord, ¿no? Como dirían las personas, se fue demasiado rápido. Eso no quiere decir que se saltaron pasos, que no pusieron atención si es segura o no. Eso no es lo que quiere decir. Como les estaba diciendo antes, muchos niños no tienen muchos efectos cuando le da la vacuna. Cuando les da el virus. Cuando te dan la vacuna, ya sabemos que a los adultos sí tienen efectos secundarios. Todas las vacunas tienen efectos secundarios. Todas. Pero la mayoría de ellas no es una cosa que te va a mandar al hospital. En los estudios que se hicieron para los niños que tienen 12 y más, fiebre, le dolía sus músculos, se puso rojo en el sitio donde le hicieron la vacuna, se sentían cansados y eso se espera. También hay que pensar en las personas que les puede dar una reacción alérgica. Esto no es muy común, pero sí puede pasar. Entonces, si usted tiene miedo a eso, realmente se recomienda para todos. Si usted va a llevar a su niño, por favor, espere el tiempo que le dicen ahí en la clínica o en el hospital. Espere 15 o 30 minutos para estar seguros que no hay una reacción alérgica, porque eso es diferente y eso sí necesita ayuda de un doctor, una enfermera o estar en el hospital. Bueno, ya sabemos, ¿no? Que la vacuna, muchos adultos, millones de adultos en los Estados Unidos ya la han recibido. Muchos, aunque tengan alergias a la comida, aunque tengan alergias a un medicamento como la amoxicilina, la pueden recibir. No hay ninguna razón para que no la puedan recibir. Es importante saber eso. Aunque su niño tenga alguna alergia a comidas, no es lo mismo. No, eso no significa que tienen mayor riesgo de tener una reacción alérgica para la vacuna del COVID. Tienen los mismos chances que cualquier otra persona de tener una reacción alérgica. Bueno, la verdad, cuando las personas que están pensando que que quieren estar embarazadas o ya están embarazadas o están en la lactancia, no se recomienda esperar. Es importante saber, sí, que ninguna de las personas que estaban en los estudios que se hicieron en adultos estaban embarazados. No hay estudios que se hayan hecho en las personas, en estas personas que decidieron donar su tiempo y que les dieran la vacuna por primera vez. Ninguno de ellos estaban embarazados. Pero los estudios que se hicieron antes en animales y la información que hay después de que se dio la vacuna, no hay ninguna razón para preocuparse que no se la puedan dar si quiere estar embarazada o si ya está embarazada o si está dando pecho. No es razón para que no reciba la vacuna. Bueno, esto quiero decir que simplemente está hablando de las personas que participaron en los estudios antes de que la vacuna fuera aprobada. Esto no es sobre los adultos, eso no es sobre los niños, es los adultos y simplemente nos está enseñando que los estudios incluyeron a personas de la raza blanca, a latinos, a afroamericanos, a las personas, otras personas, o sea que más o menos representa un poco la población de los Estados Unidos. Otra vez es simplemente información sobre las personas que participaron en el estudio y como ustedes pueden ver, hay muchas personas que tenían problemas del corazón, diabetes, pero acuérdense que esto no es en los niños, esto es las personas adultas que participaron en los estudios. No hay información así como esta para los niños que participaron en los estudios. Muchas personas ya me han preguntado estas cosas aquí en la clínica también, que si la vacuna va a ser mandatoria. No, la vacuna no es mandatoria en este momento. Para que las vacunas sean mandatorias, por ejemplo, en las escuelas, primero se tiene que haber más información, ¿no? Todavía se está recogiendo información que tanto se pasa el COVID-19 en las escuelas, entonces todavía no es mandatorio. Obviamente se recomienda, tal vez algunas instituciones como los hospitales lo vayan a hacer mandatorio, pero en este momento no lo es. No lo es. También ya hablamos sobre por qué se cree que la vacuna fue producida tan rápido. Creo que eso ya lo hablamos un poco y hablamos de la efectividad. Como lo dije, ninguna vacuna es 100% efectiva. Ninguna vacuna lo es. Y la pregunta que todo mundo hace también, que si la vacuna me va a cambiar mi código genético, creo que eso ya lo hablamos. No, la vacuna no te puede cambiar tu código genético. Simplemente no es imposible. En las células humanas, el núcleo es donde está tu código genético, está en ese espacio que se llama el núcleo y esta otra tecnología no trabaja ahí. Trabaja de otra manera. Entonces, no te puede cambiar tu código genético. No hay ninguna información que diga tampoco que te vaya a afectar tu fertilidad. Hay personas que han reportado que han tenido cambios en su ciclo menstrual. No hay ningún estudio todavía que diga que tengamos preocupación que va a cambiar tu ciclo menstrual. Alguien me preguntó en español esta pregunta ya, y creo que ya la hablamos en inglés, de que tengo que esperar a que mi hija tenga mi periodo para poderle dar la vacuna. No se recomienda que espere. La vacuna le va a causar problemas de infertilidad. No hay ningún dato científico que diga eso. La vacuna le va a hacer que cambie su ciclo. Como le estaba diciendo, no hay realmente ningún dato científico. Lo importante es hablarlo con su pediatra y tener en cuenta que las niñas que tienen sus periodos por primera vez tienden a tener un periodo que se salta meses por el primer año o en los primeros 2 años. Entonces esto ya se espera. No quiero que piensen que porque le dieron la vacuna, entonces por eso fue que mi hija le vino el periodo 1 mes y le saltó 3 meses y vino hasta el 4. Esa no es la razón. Eso sabemos que pasa en las niñas. Entonces no quiero que esperen. Si realmente quieren darles la vacuna, no quiero que esperen por eso. Esa no es una buena razón. No está fundada en ninguna información científica. Olivia, no sé si había alguna otra pregunta en español que tal vez no hablé a través de la presentación.
La única nueva que veo que llegó hoy pregunta sobre su hijo teniendo asma y ADHD y si es recomendable.
Sí, claro que sí, porque tu hijo tiene asma, eso lo hace tener más riesgo a enfermarse. Entonces la pregunta que si su hijo tiene asma, ¿debería de darle la vacuna? Sí se recomienda, mucho más porque tiene asma y es una enfermedad que le afecta sus pulmones. Ahora, si tiene el síndrome de hiperactividad, si la preocupación es que le vaya a afectar por los medicamentos que toma, la mayoría de estos medicamentos son como estimulantes, ¿no? Creo que la mayoría de las personas sabe de algunos nombres de medicamentos. No hay razón para pensar que eso le vaya a causar un problema. Entonces, se le recomienda, a menos que hayan otros problemas, como le digo, si por ejemplo le dan la primera vacuna y tiene una reacción alérgica, no se la van a dar la segunda, pero tener asma es una buena razón para que se la den la vacuna, no para que no se la den. No sé si había otra pregunta que me acuerde, porque creo que la mayoría estaban dirigidas a lo de la infertilidad, a las preocupaciones con el ciclo menstrual.
Sí, es lo que estoy
Creo que
viendo,
no.
doctora.
Sí. Creo, creo que estoy viendo en el chat, pero creo que esas preguntas son en inglés y están más dirigidas sobre la tecnología de la vacuna. Y creo que alguien me preguntó que si los números, creo que sobre el sistema, sobre el síndrome de inflamatorio fueron en todo el país. Y la respuesta creo que la respuesta para eso es sí. Pero no me acuerdo ninguna otra pregunta específica que me hayan mandado antes que no hayamos hablado ya.
Correcto.
Creo que no hay otra en español, ¿verdad?
No, no se ve ninguna otra nueva.
No, creo que no. No.
Muchas gracias, doctora. No sé si tiene otras pocas palabras para terminar la presentación.
Bueno, ya terminamos con la sección en inglés, ¿verdad? ¿O
Sí.
pensamos que todavía tenemos participantes en inglés o ya no?
No, ya terminamos.
No, ok. Creo que la verdad sí me preocupa, y esto es personal como pediatra, que hay mucha desinformación y quiero hacerlo claro que nadie le está forzando a que lleve a su niño que le den la vacuna. Simplemente queremos que tenga la información adecuada. Si tienen preguntas, es mejor preguntarle a su doctor. No queremos que haya miedo fundado en desinformación, que muchas veces está en las redes sociales, y esa no es la manera correcta de educarnos. Realmente no lo es, no nos sirve de nada y no ayuda a tener conversaciones abiertas y no nos ayuda a tener conversaciones basadas en la ciencia. Nadie le está diciendo, como le digo, obligándolo. Usted tiene la última decisión porque es su niño, es su bebé, es su adolescente. Nadie lo está obligando. Y sí entiendo que hay un poco de miedo porque se piensa que fue muy rápido. Entonces, como yo siempre le digo a los papás, esto es una cosa de una balanza. Cuando usted se toma un Tylenol o una aspirina, es lo mismo. Yo sé que me va a haber un efecto, pero ¿por qué me lo estoy tomando en ese momento? Es lo mismo. ¿Cuál es lo que voy a sacar de esto? Y si los efectos secundarios son pocos, pero los chances que me enferme mucho si me da esta enfermedad son grandes. Entonces, usted tiene que poner todas esas cosas en esa balanza y pensarlo así. El objetivo de esto es simplemente hablar y dar la información correcta. Y pregunte, al final, pregunten. Preguntando no se pierde nada.
Muy cierto. Gracias. De parte
Sí,
del
está bien.
Distrito 21, les deseamos a todas las familias mucha salud durante este tiempo. Muchísimas gracias por acompañarnos esta noche. Gracias, muchísimas gracias a la doctora y les deseamos una bonita noche a todos.
Bonita noche.
Gracias.
All right, thank you so much. I hope everyone has a wonderful evening and I appreciate you attending.
No problem. I hope this was helpful in some way. I know that there was a lot of questions, I think, that they were left there because this is a thing that, you know, brings up a lot of questions and a lot of concerns. So I hope that this was helpful for you guys.
Very much. Thank you so much for your time. It was a pleasure to meet you.
No problem.
Thank you.
Same. Have a good one. Have a good night.
Okay,
Thank you.
good night.
Yep. Good night.